Have you ever noticed your heart beating faster than usual while you're just sitting on the couch watching your favorite show? Or perhaps you felt dizzy after getting up from bed, even though you move slowly. These might seem like small, everyday moments, but they could actually be your heart trying to tell you something important. Heart failure isn't always the dramatic chest-clutching scene you see in movies. Most of the time, it starts quietly, with gentle signs that are so easy to miss or dismiss as just getting older. That's exactly what we're going to talk about today. We're going to explore those early quiet signals that your heart might be sending you long before things become serious. This isn't about medical terms that are hard to understand or frightening numbers. This is just a friendly conversation about listening to your body and understanding what it might be trying to say. Because when it comes to your heart, the small signs today could prevent big problems tomorrow. If you're ready to learn what your heart might be whispering to you, type the number 1 in the comments. If you're not quite ready, just type 0. And make sure you hit that subscribe button for Health 365. Let's start by looking at the very first sign that most people never think twice about. Your heart has a rhythm, a steady beat that keeps everything flowing smoothly through your body. But sometimes, when your heart is getting tired, it starts beating faster, trying to keep up with what your body needs. That's why one of the earliest signs of heart failure is a heart that races even when you're completely relaxed. When you're sitting quietly, maybe reading a book or watching television, your heart should be beating calmly, somewhere between 60 and 100 beats each minute. But when your heart muscle isn't as strong as it used to be, it has to beat faster to pump the same amount of blood around your body. You might notice your heart suddenly pounding in your chest or feel like it's fluttering or skipping beats for no reason at all. Many people describe it as feeling their heart jump or thump in a way that catches their attention, even during the most peaceful moments. This isn't something that happens once and goes away. Over time, this extra work makes your heart even more tired. The American Heart Association has found that when your resting heart rate stays high for long periods, it's connected to heart failure developing sooner and causing more complications down the road. If this sounds like something you've experienced, don't just ignore it. Try keeping a simple record of your heart rate, especially when you haven't been doing anything active. You can check it with a basic fitness watch, or many phones now have apps that can measure it. If you consistently notice your heart beating more than 100 times per minute while you're resting, it's worth mentioning to your doctor. It's such a small thing to track, but it could make a huge difference in catching problems early. Now let's talk about something that happens in your mind, something that many people just chalk up to getting older. Have you ever walked into a room and completely forgotten what you went there for? Or maybe you've been in the middle of a conversation and suddenly lost track of what you were talking about. It's easy to think this is just normal aging, but it might actually be your heart affecting your brain. Your brain needs a constant supply of oxygen-rich blood to work properly, just like a car needs fuel to run smoothly. When your heart isn't pumping as well as it should, less of that vital blood reaches your brain. Without enough oxygen, you might start feeling foggy, forgetful, or like you're thinking through a cloud. It's not just the occasional senior moment we all have. Research published in the Journal of the American College of Cardiology shows that even in the early stages of heart failure, people often experience problems with memory and concentration. You might find yourself misplacing your keys more often, having trouble following along with a movie plot, or feeling like your thinking just isn't as sharp as it used to be. If this sounds familiar, try paying attention to when it happens. Do you feel more confused after climbing stairs or doing light housework? Does it get worse as the day goes on? These patterns can help your doctor understand if there's a connection between your heart and your thinking. This isn't meant to worry you, but catching these changes early means you can protect both your memory and your heart at the same time. Let's move on to something you might notice at the end of a long day. When you take off your socks in the evening, do they leave deep indentations around your ankles? Or maybe your shoes that fit perfectly in the morning feel tight and uncomfortable by dinner time. That puffiness in your feet, ankles or lower legs could be another early warning that your heart is working harder than it should. When your heart struggles to pump blood efficiently, that blood can start backing up in your veins, like water backing up in a slow drain. This causes fluid to leak out into the surrounding tissues, which is why you see swelling, especially in your lower body, where gravity pulls everything down. It's not just about having sore feet after a long day. It's actually a sign that your blood isn't circulating the way it should. Doctors have a name for this: peripheral edema, and it's one of the red flags they look for when checking for heart problems. The National Heart, Lung and Blood Institute explains that when fluid starts building up in your lower body, it's often because your heart is under strain. Here's a simple test you can do at home. Press your thumb firmly against your shin bone and hold it there for about 10 seconds, then let go. If you can see the dent from your thumb for more than a few seconds, that's a sign of fluid retention. If you notice new swelling that doesn't go away overnight, especially if it comes with unexplained weight gain or trouble breathing, don't wait to mention it to your doctor. Your legs might be telling you an important story about what's happening with your heart. Next, let's talk about those moments when the world seems to spin around you. Do you ever stand up from a chair and feel like the room is tilting? Or have you had times when you felt like you might faint during everyday activities? These dizzy episodes are more than just part of getting older. They can be your body's way of showing that your heart isn't getting enough blood to your brain. When your circulation isn't strong enough, even simple movements like standing up or walking to the kitchen can cause a sudden drop in blood flow to your brain. That's why many people in the early stages of heart failure report feeling dizzy, lightheaded, or like they might pass out. Studies published in the European Heart Journal have confirmed that when your brain doesn't get enough blood supply, these symptoms are very common. It's not just uncomfortable, it can actually be dangerous, especially for older adults. Feeling faint or losing your balance increases your risk of falling and getting seriously hurt. If this happens to you regularly, don't brush it off. Keep track of when these episodes occur and what you were doing when they happened. Does it happen when you get up too quickly, after walking upstairs, after standing for a while? These details are important clues for your doctor. When you do feel dizzy, sit down immediately, take slow, deep breaths, and give your body time to recover. But most importantly, make sure you discuss these episodes with your healthcare provider. Paying attention to these warning signs can help protect both your heart and keep you safe from falls. Now, I want to talk about something that might be disrupting your sleep more than you realize. Do you find yourself getting up to use the bathroom multiple times every night? You might think it's just your bladder getting smaller as you age, but frequent nighttime trips to the bathroom, something doctors call nocturia, can actually be an early sign that your heart is struggling. Here's what happens. During the day, when you're up and moving around, fluid can collect in your legs and feet due to gravity. But when you lie down at night, all that fluid shifts back into your bloodstream. Your kidneys then have to work overtime to filter all this extra fluid, which means more trips to the bathroom. Getting up 3, 4, or even more times during the night isn't just about an overactive bladder. It often means your body is dealing with too much fluid, which can be a sign of early heart failure. The Cleveland Clinic notes that this symptom often shows up before other, more obvious signs of heart problems. And it's about more than just being inconvenient. When your sleep gets broken up night after night, it leaves you exhausted, weakens your immune system, and puts even more stress on your already struggling heart. If this is happening to you regularly, try keeping track of how many times you wake up and whether you notice your legs swelling during the day. Simple things like propping your feet up while watching TV in the evening might help reduce some of the fluid buildup. But if it keeps happening night after night, it's definitely something to bring up with your doctor. Your body needs restful sleep to heal and recharge, and if your heart is interfering with that, it needs attention. Let's talk about something you might notice about your hands and feet. Have you found that your fingers and toes stay cold even when everyone else in the room feels comfortable? This isn't always about poor circulation from aging or just being sensitive to cold. It can actually be a sign that your heart is having to make some difficult choices about where to send blood. When your heart isn't pumping as strongly as it should, your body has to prioritize. It makes sure your brain, heart, and other vital organs get the blood they need first, which can mean less blood reaches your arms, legs, hands, and feet. That's why some people with early heart failure describe their fingers and toes as feeling chilly or even numb, no matter what the temperature is like. Sometimes you might notice that the pulse in your wrist or ankle feels weaker than usual, because the blood isn't flowing there as strongly as it should. Research published in the American Journal of Cardiology has shown that this reduced blood flow to your extremities is actually quite common in people with early heart problems. It's your body's way of protecting what's most essential, but it leaves your hands and feet feeling left out in the cold. If you notice this happening frequently, pay attention to how it compares to other people around you. If your hands are cold when others are comfortable, or if they stay cold even when you try to warm them up, that's worth mentioning to your doctor. Cold hands and feet might seem like a small thing, but they could be early signals of something more important happening with your heart. Now let's discuss something that shows up when you try to be active. Do you find yourself getting out of breath from activities that used to be easy, like walking up a flight of stairs or carrying groceries from the car? Getting winded from light activities is one of the most common early signs that your heart isn't working as well as it should. When your heart can't pump blood strongly enough, that blood starts backing up into your lungs, making it harder for oxygen to get where it needs to go. That's why even simple tasks can leave you feeling like you just ran a marathon, gasping for air and needing to sit down. This isn't about being out of shape or lazy. Research from the Journal of the American Medical Association shows that getting short of breath during mild activities often appears years before doctors officially diagnose heart failure. Many people dismiss it, thinking they're just getting older or more sedentary, but it's really their body sending up a flare. If this sounds like your experience, start paying attention to patterns. Do you notice it when you're carrying laundry upstairs, working in the garden, or even just talking while you walk? Keeping track of these moments helps your doctor see the bigger picture of what's happening. One helpful approach is to pace yourself differently. Take more breaks, move more slowly, and don't try to push through severe fatigue. But most importantly, don't ignore what your body is telling you. What seems like a minor inconvenience today could be your heart asking for help. Here's another warning sign that shows up when you're trying to rest. Have you ever lain down in bed and suddenly felt like you couldn't breathe properly? Many people with early heart failure find that they need to sleep with extra pillows, or even end up sleeping in a recliner because it's the only way they can breathe comfortably. This isn't just about snoring or sleep apnea. It's a condition doctors call orthopnea, and here's what's happening. When you lie flat, fluid in your body shifts around and can put extra pressure on your lungs. If your heart is already weak, it can't handle this additional burden, and you end up feeling like you're suffocating or can't catch your breath. Studies from the New England Journal of Medicine show that orthopnea is actually a strong predictor that heart failure is getting worse, often showing up before other classic symptoms become obvious. You can test this for yourself by paying attention to how many pillows you need to sleep comfortably. If you consistently need 2 or 3 pillows, or if you only feel comfortable sleeping sitting up, that's definitely something your doctor should know about. Let's look at another sign that can appear seemingly overnight. Have you ever stepped on the scale and been surprised to find you've gained several pounds in just a day or two, even though you haven't changed what you're eating? Rapid weight gain like this often isn't from food at all, but from your body holding on to extra fluid, which is a classic early warning sign of heart failure. When your heart isn't pumping effectively, your kidneys respond by holding on to salt and water, trying to help maintain your blood pressure. But this extra fluid doesn't just show up on the scale. It can cause swelling in your belly, make your ankles puff up, and even make it harder to breathe comfortably. The American Heart Association considers sudden weight gain of more than 2 to 3 pounds in one day or 5 pounds in a week to be a serious warning signal that your heart needs immediate attention. That's why many doctors recommend that their patients weigh themselves at the same time every morning, preferably right after waking up and using the bathroom. It's one of the simplest ways to catch dangerous changes before they become life-threatening. If your weight jumps up suddenly, don't wait to see if it goes away on its own. Call your healthcare provider right away. Keeping a small notebook where you write down your weight each day can make all the difference in catching problems early. A few pounds might not seem like much, but when it comes to heart health, those pounds could be your body's emergency signal. Now, let's talk about a sign that affects your stomach and appetite. Have you been feeling full after just a few bites of food, or dealing with bloating that doesn't seem related to what you've eaten? This uncomfortable feeling of fullness in your belly can be another early sign that your heart is struggling. When your heart weakens, fluid doesn't just build up in your legs and lungs, it can also accumulate in your abdomen, putting pressure on your stomach and liver. This makes you feel stuffed and uncomfortable, even when you haven't eaten very much. Many people think they're just having digestion problems or that their stomach is slowing down with age, but it's actually their heart having trouble keeping blood flowing smoothly throughout their body. The National Heart, Lung and Blood Institute recognizes that abdominal swelling and loss of appetite are common signs in people with early heart failure. If you're experiencing this, try paying attention to whether your pants feel tighter around the waist by evening or if you've lost interest in foods you used to enjoy. Keeping a simple diary of what you eat and how you feel afterward can be really helpful for your doctor to understand what's happening. This isn't just about comfort. If your body can't take in enough nutrition because you feel too full to eat, it can make you even weaker. Taking care of your appetite means taking care of your overall strength and health. Let's discuss another overlooked warning sign. Have you developed a persistent cough, especially one that bothers you more at night when you're lying down? For many people with early heart failure, this cough is dry and nagging, and it often gets worse when they try to sleep flat. Some people even describe a wheezing sound, similar to asthma, but asthma medications don't help. What's actually happening is that fluid is starting to back up into your lungs because your heart isn't pumping as strongly as it should. This extra fluid irritates your airways and makes it harder to breathe, especially when you're lying down and gravity isn't helping drain the fluid away. Research from the American Journal of Respiratory and Critical Care Medicine shows that this type of nighttime cough is a common early warning sign of fluid buildup related to heart problems. If you've noticed a cough that doesn't respond to typical cold or allergy treatments, keep track of when it happens. Does it get worse when you lie flat? Do you sleep better when you're propped up on pillows? These details are important clues for your doctor. Sleeping with your head elevated might help you feel more comfortable, but remember that this only addresses the symptom, not the underlying problem. If you have a persistent cough that's keeping you awake, especially if it's worse when lying down, your heart might need evaluation. Here's an unusual sign that many people don't expect. Do you ever bend down to tie your shoes or pick something up off the floor, only to find yourself short of breath within just a few seconds? This surprising symptom even has a medical name, bendopnea, and it's not about being out of shape. It's actually a direct signal that your heart is struggling to handle changes in pressure when you lean forward. When you bend over, blood shifts toward your chest. In a healthy heart, this isn't a problem at all. But when your heart is failing, this extra pressure makes it much harder for blood to flow through your lungs properly, leading to quick breathlessness. A study published in the Journal of the American College of Cardiology found that many patients with heart failure reported symptoms of bendopnea within 30 seconds of leaning forward. If this happens to you, pay attention to it. You might notice it while tying your shoes, gardening, loading the dishwasher, or reaching into a low cabinet. Keep track of how quickly it happens and how long it takes for the feeling to go away after you straighten up. It might feel like just a minor inconvenience, but it's actually a powerful early clue that your heart is under more stress than it should be. Finally, let's talk about one of the most common and exhausting warning signs. Do you feel tired all the time, no matter how much sleep you get? Many people with early heart failure describe a bone-deep fatigue that rest just doesn't fix. It's not the same as normal tiredness after a busy day. It's your body's way of telling you that your heart isn't pumping enough oxygen-rich blood to supply your muscles and organs with what they need to function properly. This constant lack of energy makes everything harder. Simple tasks like making breakfast, folding clothes, or taking a shower can leave you feeling completely drained. Studies published in the journal Circulation confirm that reduced ability to exercise and chronic fatigue are among the earliest and most disabling symptoms of heart failure. Unlike normal tiredness that gets better with rest, this exhaustion just lingers. You might notice that you can't walk as far as you used to, or that you need to take breaks during activities that were once easy. This kind of fatigue often develops gradually, making it easy to dismiss until it becomes overwhelming. If you're experiencing this, listen to what your body is telling you. Keep track of how often you feel worn out and what activities seem to trigger it most. Share these observations with your doctor because they can reveal important patterns about your heart health. Your energy and strength are so important for maintaining your independence and quality of life. Noticing these changes early and taking action can make a real difference in your future. So, there you have it. We've looked at how heart failure often begins not with dramatic symptoms, but with quiet, gentle signals. A heart that beats too fast while you're resting, ankles that swell by evening, nights interrupted by bathroom trips, or simply feeling more tired than you used to. These signs are easy to overlook or explain away, but they're actually your body's way of asking for help and attention. The encouraging news is that catching these early warnings can truly change everything. With proper medical care, smart lifestyle choices, and the right support, many people go on to live active, fulfilling lives even with heart problems. Your heart has been with you through every moment of your life, every laugh, every tear, every celebration. It deserves your attention and care in return. If this video has given you some helpful insights, please share it with someone you care about. Together, we can help more people recognize these important early warning signs. And don't forget to subscribe to Health 365, where we'll continue bringing you practical, caring guidance for living your healthiest life.